Hello, dear friends. Welcome back to our channel. Today, we're seeing a new patient, Natalie. She's 27 years old and works in television. Standing a lot during work has led to ongoing spinal problems. Right now, she's mainly complaining about neck pain and discomfort around her right shoulder blade. In addition, because she's active in sports, she often experiences pain and tension in different parts of her back. She's had issues with her lower back too, including sciatic nerve impingement that took a long time to heal. Altogether, she's been dealing with spinal problems for about 7 years. In her past experience, Natalie regularly visited massage therapists. She preferred strong, intense sports massages, which helped for a while. If she combined massage with back stretching exercises, the effects lasted longer. She also visited osteopaths, but found the treatment rather superficial. Some touches, a few pressure points, nothing particularly noticeable. At one point, she experienced a serious wrist nerve injury. Her hand temporarily lost function. Neurologists and neurosurgeons were involved in her recovery. Around 15 IV treatments, acupuncture, physiotherapy, and medications were needed to restore mobility. They also conducted diagnostic tests like EEGs. In the end, she was prescribed therapeutic exercise. And at first, she followed the program diligently. However, as often happens, once the acute pain subsided, she stopped doing the exercises. That's a big mistake many patients make. Therapeutic exercise, or LFC, should be a lifelong commitment for anyone with spinal issues. After collecting her full medical history, we moved on to the physical examination. First, standing with axial load. I noticed that her left scapula protrudes more strongly. We definitely need to strengthen the rhomboid and serratus muscles to help correct scapular positioning. There was also a mild imbalance. Palpation revealed hypertonicity along the cervical spine. Clear trigger points were present, especially noticeable on pressure. When bending forward, the right side of her back shifted higher, confirming asymmetry in load distribution. We then moved to a horizontal position to reassess without axial load. Palpation confirmed significant tension, especially in the right quadratus lumborum. Interestingly, while standing, the left scapula seemed worse. Lying down, the right side became more prominent. This discrepancy is important for therapy planning. After examining, we moved to a warming massage session. Although we don't usually film the massage itself, it was important to show the fascia work today. Tension in the fascia can cause pain radiating into the legs, so we focused on releasing it, starting with the right side. With light, precise movements, using just one finger, we targeted the fascia attachment points. Natalie experienced noticeable sensitivity, confirming fascial tightness. After finishing the right side, we moved to the left. There, the sensitivity was lower, but still present. We explained that weak lumbar muscles often cause overloading of the fascia. That's why, when patients come with acute back pain or hernias, we first work on stretching the leg muscles. They tend to shorten under stress. After the fascial release, we continue to spinal manipulations. Starting with the lumbar region, a gentle but firm adjustment resulted in a satisfying release. Natalie was a bit surprised by the cracking sounds, but that's normal. Full relaxation followed. We then worked through the thoracic spine and scapula areas, rotational stretches, and gentle corrections on both sides. Throughout the session, Natalie showed bright emotional reactions, sometimes laughter, sometimes surprise, but overall, she tolerated everything very well. We carefully adjusted the cervical spine too. Lateral stretches, small mobilizations, all performed symmetrically. finished the main work, we moved into full spinal decompression. Natalie experienced a strong but comfortable release. As often happens, the decompression brought immediate lightness, and she even noticed her toes moving reflexively. An indicator of nerve system activation. We didn't forget to check the hip joints either. Often hidden restrictions can add to lumbar strain. Here, everything looked fine, although some tightness was present. Finally, we showed Natalie an important exercise for scapular control. Using a simple resistance band, she learned how to perform shoulder external rotations correctly, giving tension to the band, rotating the arm outward while keeping the torso stable, activating the rhomboid muscles and maintaining scapular control. We demonstrated each movement carefully, emphasizing the correct technique. No swinging of the body, only isolated movement of the arm and scapula. She practiced it under supervision, and although it wasn't perfect immediately, she quickly caught the feeling of proper engagement. We also showed her how to perform classic rowing movements for strengthening the rhomboids and improving posture. These exercises are critical to stabilize the shoulder blades and maintain spine health long-term. Before finishing, I reminded Natalie and all viewers that manual therapy alone is not enough. It needs to be fixed with regular physical exercises. Otherwise, the improvements will be temporary. Natalie felt real relief. The stiffness in her neck was gone, her back felt lighter, and she herself admitted what seemed scary at first turned out to be easy and even pleasant. We made it clear, spinal care requires constant attention. You can't treat your body once and forget about it. Health is priceless, and you can't buy it at a supermarket discount. That's it for today. Thank you for watching until the end. Be sure to subscribe. Many exciting videos are coming soon, including demonstrations of self-care techniques. Stay healthy. See you next time. You next.